Where I wanted to start today was welcoming Lucia and John. I will allow them to introduce themselves as we dive into our discussion, but they were tremendous help and support as we built our federal comment toolkit that we launched just last week. And, you know, I think this is a really important time for us to be cognizant about our community, which is growing incredibly rapidly, and with the current backdrop has such a great deal of focus on it in terms of being able to perform and come through for patients in need. How can we participate in the legislation and the rulemaking around this to make sure that our field grows in the way that very best supports not just the industry, but all of the patients that we exist to serve. In terms of format for today, we'll take a little bit more of a discussion-based format rather than a didactic approach. And with that, Lucia, I might pose the first question to you. I'll ask you to give us a little bit about your background in government and to help us understand the rulemaking process and which government bodies are involved in rulemaking around digital health in particular.
Sure, thanks so much, Jen. Hi, everybody. It's really great to be here today. I'm currently head of privacy and regulatory at Omada Health, and I've been there about 3 years. And before joining Omada Health, I did a 2.5-year stint in the Department of Health and Human Services within the Office of the National Coordinator for Health IT, where I was Chief Privacy Officer. And prior to that, as a privacy and regulatory healthcare lawyer in various other capacities, public and nonprofit. The Digital Medicine Society has put together these couple of really great slides, and I think a really key thing to understand is you almost have to go back to whatever you learned about government when you were in grade school or high school, and think about how the functions of government work, right? We have put the judiciary aside, not too involved here. We have the executive, we have the legislative. Legislative branch makes a statute or a law, and when they do that, they authorize the executive agency to elaborate on what that means. And that process is called the regulatory process, or rulemaking, or administrative rulemaking. And in healthcare, every organization federally that has the authority to make significant rules that impact healthcare are all under the umbrella of the Secretary of Health and Human Services. So that's Alex Azar. So you can see on this slide where Jen has HHS, the HHS bucket, there's a very long vertical of different agencies, but they're all within that and report up to the Secretary. So the Commissioner of the Food and Drug Administration reports to the Secretary. The Administrator for CMS reports to the Secretary. The head of the CDC reports to the Secretary, et cetera, et cetera, et cetera. And all of those agencies have their own remit or jurisdiction or sort of playing field on which they do their activity. And it's very important in the innovation community to sort that out in your head. So a really great example of that is the Federal Food and Drug Administration. So they are super interested in security and privacy, but they actually don't have any regulatory authority in those spaces. They can write, guidance and exhort device makers to make secure devices, but they don't actually have the authority to investigate or punish somebody who wrote an insecure device. That authority lies with sometimes the Office of Civil Rights and sometimes non-governmental agencies entirely. It's really important to understand each agency's remit. And in this chart, Jen has kind of listed them in general, and they're government agencies, so they all have public websites, so you can go to your Google search bar and search FDA org chart, and one will pop up. And each division within the FDA will describe what it does, who does food, who does drugs, who does cosmetics, who does devices, etc. The other 3 agencies we have up here also have some significant impact, but not at the scope and depth of HHS. So the second one that Jen has listed is the Federal Trade Commission. So the Federal Trade Commission, the best way to think about it in this space is as the Federal Consumer Protection Agency. Every state has its own consumer protection agency, and the feds have one too, and that's the FTC. And their authority is to make sure that commercial organizations that are not nonprofits are actually explaining to consumers what they do in a fair, not misleading, and transparent way. So you can't lie to the consumers, and you can't fail to tell them what you're going to do. And that relates to many different aspects of health, from what is a safe product in the consumer space to is that product asserting security or privacy terms that are false. You'll all have read about Facebook that has some aspects of health in it, but there are many, many other decisions where the Federal Trade Commission has pursued an organization that makes assertions about health that are just blatantly false. Next up is the Federal Communications Commission, which should not be confused with the Federal Trade Commission. The FCC is the federal agency that regulates our broadband. So they don't regulate the companies using the broadband, but they regulate who sells the broadband, how that broadband is sold, the licenses of the federal broadband, et cetera, et cetera, et cetera. So in like a digital world, here's how the FCC might implicate Omada. We have digital services. We are clearly a provider. The Health and Human Services has a lot to say about what we do. We are a for-profit company. The Federal Trade Commission has a lot to say about what we do. And we rely on the Federal Communications Commission to make sure our broadband suppliers are operating in an appropriate way. But the FCC doesn't really have direct oversight of what we do as a business. We're just buying a service that the FCC oversees. And lastly is the Office of Management and Budget. So this is, if you think about this as the sort of chief operating officer for the White House aspect of the executive. All federal rules have to go through OMB. They obviously write the federal budget that's proposed to Congress, and they have many, many different aspects. So when any of your agencies like HHS or the subdivisions, Federal Food and Drug Administration, Office of the National Coordinator, CDC, et cetera, want to publish something and receive public input on it and take significant activities and ask for more money, they all have to go through OMB. So it's a really good way to think about it as the sort of chief operating officer for the executive branch. Jen, did I cover what you wanted me to cover?
Yes, that was fantastic. A really nice overview to sort of the agencies involved and sort of the steps in the process. John, I wonder if you could, first of all, sort of introduce yourself to everyone on the line, and thank you again for being with us. The really interesting thing, as I learned about the public comment process, is that anyone can participate. And as you introduce yourself, I wonder if you could go on to tell us a little bit about sort of your role and how you think about why it's important to you to participate in sort of the public comment process and how you do that in your current role.
Sure. So first of all, thank you, Jennifer and DiMe, for having me on this. It is an honor to be a co-panelist with Lucia. A lot of what I know I learned from her, but any mistakes I make are mine and mine alone. So let me start with that caveat. So I worked in government very briefly a long time ago in the 90s and increasingly a long time ago in the mid 90s. And one of the things that has always struck me is that I didn't know before I came to DC in 1994 is the degree to which comments on rules drive the final rule. It seems like such a prosaic thing to do, but the reality is that for a variety of reasons, mainly involving transaction costs, like you had to sort of follow the Federal Register to know that a rule had a comment. You maybe had to do that at a library where you had to look at a print version of it. And so we've never cultivated this culture of commenting on the federal rule. It was always sort of experts, elites around DC, or that could, spend the money to monitor DC would do the commenting. And over the last 20 years, that's kind of evaporated. You can follow topics, you can follow the Federal Register, you can comment. It's even gotten to the point where spam in the comments has become a problem, but only in net neutrality debates. And so I work now at a nonprofit called Sage Bionetworks. We are an open science and collaborative science platform nonprofit. We are very significantly affected by the rules under which federal research is conducted, as well as by the rules under which federal health IT is regulated. Because we convene communities of scientists, we run our own mobile research studies, we run challenges and platforms. All these things are directly affected by federal rulemaking, whether it's privacy rules or research protection rules or procurement or you name it. And so over the last couple of years, we have increasingly at Sage prioritized responding to federal requests for comments because we realized it's sort of the equivalent of voting in a local election. Where only maybe 1 in 1,000 or 1 in 5,000 people vote for school board, but thousands of people are regulated by the outcomes of those elections. And we realized that we can have sort of an outsized impact by participating and by getting other people to participate in this sort of underused part of the rules making process. So we've now responded, I think, to 8 RFCs and RFIs, requests for comments, requests for information. Over the past year, we have brought staff resources on board, contracting to help us meet the flow of those kinds of requests, because we really do see it as a vital part of participatory democracy that is sort of, as an accident of sort of history and technology, has not been part of our sort of citizenry, but now can be part of our citizenry. And we really admire the work that DiMe has been doing in this space to help make people able to do that in a meaningful way, because it's a little intimidating. When I first started writing, I didn't know how to write a comment. And everyone's like, well, you're not doing it my way. And then you realize there's not a right way to do it. And so, you know, getting through that sort of feeling of discomfort of the first time, I think is one of the biggest things we can do to get people over the hump to say, you should be submitting if you care. And so, you know, it's just the sort of thing that we as an organization prioritize it. I now do it as a private citizen, even at the county level. Just this realization that if you feel frustrated that your federal vote doesn't mean what you want it to mean, there are other places where your voice is louder just by participating. So why would we not take advantage of it? So that's my little diatribe to hopefully convince you to use these systems.
Hey, Jen, can I add a story?
Please, yes.
I want to add a story and a fact. So the fact is that by federal law, the agency is required to have a human being read every single comment that is submitted. So if you have a rule that gets 350 comments, that's pretty easy. But if you have a rule like last year's Medicare physician fee schedule got 40-something thousand comments, that's right, 5 zeros there, five digits there, somebody still has to read it. And in fact, the agencies trade staff, like, you know, if agriculture had a really heavy load, they might borrow from EPA staff, because you can't just read them all yourselves. So that's an important thing for you to notice. Every single comment has to be read. That doesn't mean every single comment gets the same weight. And we'll talk about that, I think, in some later slides. But here's the story for you. Many years ago, in the sort of run up, the early stages of the Affordable Care Act, CMS was working on a program called the Qualified Entity Program. Qualified entities are entitled to get a set of de-identified claims data that they can then use for a variety of purposes. It started out as a price transparency tool. The original regulation proposed that you could be a qualified entity in a particular region, a state, or a sub part of a state. And I was working for a big insurance company at the time, and we argued that if you met all the other criteria, but your region was the entire nation, you should be allowed to be a qualified entity. And Medicare, in fact, adopted that rule, which has then spawned, I don't know, 8 or 10 startups, from Komodo Health to Optum has a business unit doing this, that are all nationwide qualified entities and using this data to generate really important insights for people. So yes, comments are read, and sometimes they are persuasive.
Fantastic. It's always nice to hear a story of having impact. Lucia, quick question for you. John talked about SAGE as a non-profit open source science entity contributing, and also his own comments as a private citizen. You've moved out of government and you're in tech now, working for Omada, doing great things. Do you still comment?
Oh yes, we comment a lot. A couple of our really big areas in the last 3 years have been reimbursement. So how an asynchronous digital healthcare company like Omada's gets paid is pretty important for our growth. And we want to make sure that the government regulations for payment, which are very influential in the commercial space as well, are really keeping pace with what is available for that technology can do. I think you'll see a lot more of this after we get through the COVID crisis, because people get more used to having healthcare on their phone instead of in a building. So that's a huge area. We have commented quite extensively about the way that our program fits into other federal initiatives. For example, Office of Inspector General had a proposed rule out this midwinter about value-based purchasing. So, you know, different components of the healthcare system combining together to contract in a uniform way to serve a population based on the health outcomes they could produce, and whether OIG should in that rule exclude certain kinds of digital health services or not. We argue that if you exclude digital health, you exclude the ability to get real-time evidence about what the outcome is. And we've also commented about privacy and security because we are really proud of our sort of modern tech stack using 20-year-old rules and how fast we can get data back to people and what's onerous for us or not onerous for us about that rule. Instead of sort of sticking our heads in the sand about privacy, as many people do, we want to kind of stand up for it and show how it can be done effectively with a modern stack.
Amazing. One of the things as we put this toolkit together that we've set out as one of our goals sort of at DiMe in this work is trying to, one, increase the number of sort of comments that go in on draft, you know, regs relevant to our field, but also to increase the diversity of voices commenting, whether that's from different sort of disciplinary or organization backgrounds. John, you always have really good ideas about this. You know, why is it important that we're diverse in the comments that are coming in?
Well, I mean, there's the social concept, which is that we want to be hearing from lots of voices to make sure we make fair choices. Mm-hmm. This is diversity sort of in the design sense of if you don't ask everyone, you won't build things that are good for them. And we don't want the policy equivalent of the AI that doesn't recognize Black people or that mm-hmm. mischaracterizes them or that redlines people of who are from less privileged areas, right? Like we've seen, right? We know that not including diverse voices when we're doing design work leads to worse products. And so I think that there's that angle, but there's also just like, you know, just like the pure intellectual cognitive diversity you get. Mm-hmm. The good ideas on this are often going to come from other places, especially when we're talking about digital medicine.
Yeah.
The sort of the signal thing about digital medicine to me is that it allows medicine and health, you know, to touch people in a communicative way that in the same way that their health touches them every day. So you have expertise locally in these areas. People know what they do for their health, what works for their health. They know what they care about for their privacy. Sort of authentic individual voices around that is both going to lead to a better design product, policy product, but also it's going to give the people making the rule a much better sense of what the world is like. And I think that those two things are those are so important. And part of why policy has sort of gotten separated from people's day-to-day lives is that, you know, a lot of what we've built out doesn't retain that sort of either the design benefit or the sort of empathy benefit of just seeing how people feel about it. And so when you see lots and lots of comments, they're often, you know, clones. They're just cut and paste. All that gives you is a very rude metric of how people feel. And maybe even a fake metric, because some of the stuff we saw in the net neutrality was that bots were submitting comments in people's names. But I think that it's, you know, we get better policy. The more people that participate, the better democracy works. But the other is that the people whose job it is to be representative or executive or legislative within the democracy, the more they know about what the populace thinks, the better they're going to be able to do their jobs.
The other thing I think that's really important on this one, Jen, is that the practiced commentators are incumbent large institutions and the lobbying organizations of large institutions.
Yeah.
And so, you know, we could all, each of our companies could write checks to join these large institutions and on these large lobbying organizations. And in fact, they would like nothing better, but frankly, capital may not be there. And so it becomes a DIY thing. And I recognize, of course, that not everyone has a Lucia sitting in an Armada. And we're very fortunate that I'm there, and I'm very fortunate that I get to do that work. But the comment process is not complicated once you know how to do it. And that's why this toolkit is so great. And we absolutely have to bring the new voices to the comment process because the regulators don't really know. Unless they're using all the tools that digital medicine can make available to them, they really just don't know what's coming down the pike. And they're kind of still in the mindset of people over 65 don't use smartphones, no matter how much you tell them that Pew says differently.
Yeah. So this is fantastic, guys. And I think, you know, together you've made a really strong case for why it's important that as a community, we sort of roll up our sleeves and dive in. Lucia, you teed us up for a really lovely segue towards, you know, for those of us who are inspired to comment, you know, what are those tips and tricks? And, you know, this is part of our federal comment toolkit, this little infographic that's on the screen here. And we need to be incredibly grateful to you, Lucia, because you provided a lot of this information. Tell us about what you've learned along the way, both as someone receiving comments and now someone who's out in the world writing them. Take us through these tips and tricks. Tell us about the best way that folks can efficiently and effectively share sort of their thoughts on draft regs.
So I'm going to start with the don'ts first. So, you know, this is a couple things. Comment letters are public. You will see later in this deck that Jen has gone and harvested some of the public comments, including Omada's. So that happens. We read other people's comments too. It's part of the normalized process I go through when I'm done with my comments. So you have to write accordingly. But most importantly, this isn't a sales opportunity. You're not going to sell your services to the government. This is an example to explain to them how what they're proposing will impact your business for good. Nothing is as flattering as having somebody say, yes, do that, that's the right idea, or for bad, because they don't know unless you tell them. But when you're explaining that, so no sales pitches, don't whine either. It has to be grounded in actual evidence and stories and facts. And that's why you have to be thoughtful about the fact that it's a public comment. And then, you know, no hyperbole, right? It's just not gonna sell. To John's example of the bots and net neutrality, not only were there tens of thousands of comments that didn't come from real people, but they were full of hyperbole. And those go into a special, they get read, but they go into a special basket, and then you can guess that they might get ignored. So what can be helpful? So evidence. So for example, things we've put in our comment letter are data drawn from other federal websites. It doesn't mean that the regulator can't go get that, but you're making it easy for them. We have given facts and figures about our own program backed up with evidence of that. We have given samples of, for example, how the Omada program works using screenshots and attaching them to the back of our comment letter. Anecdotes and stories that are true from real people. So there are lobbying organizations that activate their members to write stories, and some of those are definitely cut and paste. But the ones that aren't cut and paste, that are really heartfelt and have a real person behind them, they definitely get noticed. Things that can be looked up and verified, and insights into the long-term and downstream effects of how a rule might play out, especially if it's sort of, you know, it might have this bad effect that you might not have thought about it, and let me explain to you how that's going to work. Or it might have this really good effect, and that's why you should keep doing more of it. So you're helping the regulators see what's going to happen in the real world when they finalize this rule and let it loose.
Fantastic. And all of this is available, guys, but Lucia, taking us through it is fantastic. John, you mentioned how many comments that you've collaborated with as part of your work at Sage and through a variety of different collaborative efforts. What approaches do you find sort of most useful as you draft comments, and particularly when you're collaborating with other sort of organizations, other colleagues, other thinkers to provide feedback on a particular body of work?
Well, just to validate Lucia, right? So a lot of what we do is we try to tell vignettes or anecdotes out of our own experience and then explain how those either were made easier or harder by the rule and the changes that are being proposed to it. We say, you know, if you wanted more collaborations that shared data early and then published out to a data portal, here's what the rule would need to account for. So that's a lot of what we do, is that sort of true anecdotes and stories. We always add links, references, and citations for the looking up and verifying aspect of this. And then we try to sort of start with, we do the two pyramids, right? So you start at the very broad level saying, right, here's an insight that you haven't thought about, zoom down to a vignette, and then from the vignette, zoom back out to the insight. And so we'll often have, you know, 2 or 3 of these vignettes that we do the zoom, detail, zoom back as a way to talk about it. We found this a very powerful way to take abstract ideas, especially about technology or privacy, for example, or innovation, and say, well, you know, no one knows what innovation is, but everyone agrees that this thing is innovative. Here's how it worked, right? And if you want more things like that, as opposed to a vague, theoretical conversation about innovation, if you want more things that take a 10-year process and make it happen in 3 years, then your policy should do X, Y, and Z to support that, right? And we have found that that seems to land relatively well. We've also taken to open sourcing our comments before they're done. So in the last week or so before they're due, we will open them up as a Google Doc to our friends and family and say, these are kind of baked because they're our comments. But if you would like to take them and bootstrap rapidly off of them, please feel free. We don't even require attribution in those contexts, and that can help synchronize certain kinds of concepts, which is good.
Mm-hmm.
But in general, it's exactly right. The key is to be grounded in reality, to be very specific. I will say that in the times I've been in the room with fancy corporate lobbyists, they are very specific. They know exactly what they want and why they want it. We have to be the same way. You have to do some of the homework. But in particular, these anecdotes and these insights into downstream effects, because when I worked on the Hill, even though it was forever ago, the reality is that stories are the easiest thing to grasp because you're doing so many things at once. The stories you hold on to, and you often don't have time to think through all of the downstream effects. And so those are two of the most important things you can give to a person working in government, are those narratives they can hold on to understand and then explain to other people why things are important, but also that subtle knowledge of the knock-on effects that might come only with deep expertise, as opposed to the sort of episodic work that you have to do in government.
Fantastic. Guys, these insights are terrific. And let me just share with folks on the line a few of the other resources that, with your guidance, Lucia and John, we put together as part of the toolkit. One of the things that sort of blew my mind as I started thinking about how DiMe and our community could participate more in rulemaking around digital medicine topics was realizing that there wasn't a single place where all of the opportunities to comment were listed for easy access. Lucia earlier took us through an overview of all of those different organizations that participate in different pieces of the rulemaking. So what we've done is we've set up a system, and it's all available in the toolkit if you want to see how we compile this list. But this list now exists in Airtable so that at a glance you can come to it, you can see what's open for comment, access a sort of summary of the information to see if it's relevant to you and the work that you and your colleagues do and are passionate about, what phase of the rulemaking it's in, when the comment period closes. And so that's a resource that I think can save an awful lot of time and can help you guys on the line and broader participants in our community really keep on top of the opportunities to participate. As Lucia mentioned, we also wanted to compile a number of examples. John, I think you hit the nail on the head when you said, sometimes that first comment is the most intimidating. So we sort of bucketed what we really liked to some great examples from tech companies, from life sciences organizations, from a more clinical background, so healthcare systems and individual sort of clinicians, as well as clinical groups. Patient groups and nonprofit consortia. How do these different organizations is sort of come together and make their case, and what can you look at? Lucia, you share that as part of your process to see what others are saying. Hopefully this is a nice, easy resource for folks. And in addition to those comment examples, we also compiled 2 different templates. One, a very simple bulleted approach, another longer letter form, depending on what works best for the individual commenter. And then the last piece I wanted to highlight for folks on the line before I shut up and throw it open to folks dialing in to talk directly to you, Lucia and John, is DiMe's now put forth on behalf of our community 4 different comments. There are a number of open temporary final guidance documents that FDA have put out in light of everything we're handling with COVID. There's FDA's Technology Modernization Action Plan is on deck. So there are a lot of comments right now, and you saw in the Airtable, which is now available, all those different sort of aspects. If this is something that appeals to you, we now have a Slack channel within the DiMe community where you can find collaborators and share ideas. There's the template, there's the listing, there are the examples, and we will periodically hold office hours as well, sort of virtual office hours for you to come and seek help from experts if developing and preparing a comment appeals to you. With that, let me see, Lucia and John, is there anything that I've missed? And folks dialing in, I'm just switching across to my listing of you guys. Feel free to unmute yourself, raise your hand, and let's have a great discussion.
I think the only other tip I would add, Jen, is comments are submitted through an electronic portal, or they can be mailed, but typically through the portal. And if you're going to write directly into the portal, you're limited to 5,000 characters, but don't let that throw you off, because you can actually upload a PDF of any length or a Word document of any length. So, your comment in the box can say, Omada Health respectfully submits blah, blah, blah comment, and then, have 15,000 words to follow in your document. So don't let the document count on the portal throw you off.
That's a really great tip. And
I made that mistake the first time. So
yeah, I work with experienced people who have been in government affairs for a long time who've never actually done a comment, and they freak out. I'm like, no, you're just going to upload the document, and you can have it be any length you want. Now, that being said, a 30-page comment letter is going to get less close scrutiny than a 6-page comment letter. So think about the human reading on the other end and those 40,000 comments.
It's probably a good rule for life, actually, isn't it?
That's right.
The shorter, the better. David, I saw your hand raised. Let me just see if I can come over and unmute you.
Done something wrong.
No, that was me. David, you should be able to talk. We should be able to hear you now.
No, I accidentally raised my hand. I was looking at the Q&A. Thank you guys for coming together. As somebody worked in government as well, this is all great information. And as somebody who once upon a time contributed to some of those spam accounts for federal comment, I can assure you that, yes, they don't get read that well, and personal is always better.
Fantastic. Thanks, David. Sorry to call you out if that was an error there. I wonder if folks on the line, if anyone has any specific questions about comments you might be wanting to make, or how you might be able to sort of influence thinking based on your own disciplinary background. Excellent. Well, in that case, Lucia and John, I think we probably did a great job going through all of the resources available in the comment toolkit. I want to thank you both again for the hard work that you put into helping us build this resource for folks. It is a living resource. We will continue to update it with the most recent opportunities to comment. We will keep an eye on those examples and make sure that we are collecting powerful examples for folks to reference as we learn more. We'll keep an eye on those templates that folks can download and use as well, making sure that they're always as sort of valuable and fit for purpose as possible. And again, Lucia, the tips and tricks we have largely were compiled from resources that you've provided to the community broadly over time. And I hope that everyone on the line feels sort of as inspired as I have been over the last few months, as I've learned about the impact that we sort of, as passionate experts in this field of digital medicine who really want to advance the field to have the most positive impact possible, we really can influence the way that the field is directed going forward. So thank you everyone for being on the line. Before we break, let me just highlight a few other upcoming events we have here at DiMe. This Friday, our colleagues Jessalyn Dunn and Brene Bent will be leading our virtual journal club. They published some terrific work last month investigating sources of inaccuracy in wearable heart rate sensors. Really fascinating work looking across medical devices and more commercially available tools. And it's a fascinating insight into the different performance characteristics including across things like skin tone. And I think that could be a really valuable conversation for folks to participate in at this time. And then later in the month, we have a really exciting session planned. This is our lightning speed crowdsourcing event at the end of April, as students, under the strangest of circumstances, are preparing to graduate and to go into the field and really help us all drive digital medicine forward. They're going to be leading our lightning speed crowdsourcing, talking specifically about questions they have in their work and in their future career trajectories. And we'll be hoping for a really engaged conversation with members of this community. So join us on April 30th if you can. With that, John, Lucia, thank you so much for all of your hard work, for your expertise. Thank you everyone on the line for dialing in and being passionate about this topic. I hope that you do continue to monitor those opportunities for comment, that you dive in and start providing some feedback. Certainly let us at DiMe know if you start working on particular comments. We're always happy to support. We're always happy to shine a light on your hard work, and we really appreciate it. It's also just lovely during these sort of stranger times to bring everyone together. So thank you everyone for taking some time with us this Monday. Stay safe everyone, and thank you so much.
Thank you, Jen. Thank you, DiMe.
Thank you.
Thanks guys, bye-bye.